Hello everyone, I'm Dr. Matthew Reedy with Trillium Creek Dermatology, coming to you today with my colleague Dr. Wyatt Andrasik and our founder and medical director Dr. Helen Torok. Today we have a few topics we're going to be discussing, but before we get started I'd like to introduce our practice. So Dr. Torok started this practice many years ago and it's grown over the years. We now have 5 locations. We're currently in Medina, but we also have offices in Worcester, Wadsworth, Brunswick, and our newest office is Strongsville. She's built a large team. We have a lot of MDs, we have many physician assistants who are wonderful, we have a Mohs micrographic surgeon with Dr. Bayless. So the team is large, and with this large team, we all work together. We're very well trained in complex medical dermatology. We see adult patients, we see pediatrics. We also have great options for cosmetics for patients. So she's really built a comprehensive skincare center, and I think Dr. Leonard and Dr. Helen both really prioritize staying up to date with medical technology. We have the newest lasers, the newest medical devices, which gives us as providers a lot of options for our patients. And as a patient, it's really a one-stop shop. You have all the tools here, and we really strive to help you meet your skincare needs. So if you need to see us, stop by at any of our 5 locations, visit us online at tcohio.com, or if you want to call and schedule an appointment, it's 330-725-0569. We're going to jump right into the first topic. So the first topic is skin cancer, and unfortunately, very, very common. We all see several cases every day in practice, and we know sun protection is critical for preventing skin cancer. But we also know if you catch skin cancer early, the prognosis can be excellent. It's very treatable. So at Trillium Creek, we are offering skin cancer screening promotions. And why don't we start with Dr. Helen Torok? Could you tell us a little bit about these skin cancer screening promotions?
So this has been one of the most successful programs that we've ever launched in our practice. Why? Because skin cancer awareness is really now something that everybody looks at, right? Everybody's aware that they can get skin cancers, even children, thank goodness, our teenagers especially, with all their tanning beds. But we do preventative screenings, and those are, we offer those usually in the winter months. The preventative screenings are done by all of our providers, so you can get it anytime you can. You can do it online, you can call, but that's one of our most popular programs at our practice.
Exactly. Dr. Andrasik, say a patient comes in for one of these skin cancer screenings, you're doing the check, you see a lesion, you see a mole that looks suspicious. What can a patient expect for the next steps?
So at that point we would consider doing a biopsy, and a biopsy can take on several different forms. So depending on the type of tumor, we may do what's called a shave biopsy, where we numb up the skin, take a shave that's flat with the skin, and send it off. We may also do a punch biopsy if we want to try to get a little bit more depth with our biopsy, and we take what's called like a cookie cutter tool, numb up the skin again, take the piece of skin out and send it off. Even some lesions, depending on how concerned we are with it, may be okay to monitor. So we may take pictures with our iPads and even with our dermatoscopes to get a real in-depth view of that lesion, measure it, and then check back in on it, usually like 3 to 6 months, to see if it's changed, because we know that in general skin cancers will change over time, and so if we do see that change, we end up doing a biopsy.
Exactly, yep. And to add to that, when you come in for your skin cancer screenings, we check you head to toe, we look for anything that looks like cancer. But I know all of our providers, we also really try to educate our patients during these screenings. So we check you, but we're also trying to teach while we're doing it. And we want to teach you, preventative measures, wear sunscreen, wear SPF 30 and above, stick to mineral-based sunscreen that has zinc oxide or titanium dioxide, wear sun protective clothing, hats, sunglasses. And then we also try to point out common signs of skin cancer, things to look out for. So like he mentioned, if a lesion is changing, if it's growing in size, changing shape, color, bleeding, scabbing, not healing, these are all red flags. But I always also mention, it's important to check yourself, but melanoma, for example, the most dangerous skin cancer that we see on a daily basis. On men, a lot of times it occurs on the back.
Yeah.
It's impossible. I try to check my back, it's hard. It's hard to do. And for a patient who's not trained, if you're trying to check your back, it's hard to know what to look out for. So I always say, check yourself, yes, it's important, but also just get in for these screenings, see a professional, let them check you head to toe, let them check your back, and just make sure everything's safe.
The one important thing that is if you're a female and you're applying your sunblocks, I do tell my women to use a tinted sunblock. The tinted sunblocks has iron oxide in it, which I think is the third most best mineral that you can add to your sunblocks. Obviously, men are not going to use a tinted because it looks like a foundation, but in women, they just love it because you've got your foundation, which is your base, in your females, and then you've got your sunblock. And I always tell them 40 or higher for females. The iron oxide gives them that 40. Yeah.
Also important, I think, for those females who get pigment or melasma.
Yeah.
I think that iron oxide is important.
It is really important. Yeah.
Yeah, it can help protect you against the fluorescent lights as well.
Yeah.
All these lights here, right?
Yeah. All great points.
Yeah.
How often would you recommend for a patient to have one of these skin cancer screenings?
So it's very important depending on their history. If they have a very strong family history and they've had skin cancer themselves, twice a year would be recommended, every 6 months. Most patients who don't have any skin cancers, once a year is, I think, mandatory, over 40, 50. That's what I tell my patients. My youngest patient that I ever saw was 14 with a basal cell, a female, right smack dab in the forehead. So it's not just age-related, it is family, genetics, what is it, have they abused the tanning beds as teenagers? 1-2 bad sunburns increases your risk for skin cancers. If you've had a melanoma, every 3-4 months, sometimes depending on the depth of the melanoma is what we recommend. So it is all dependent on genetics, family history, and your own history of skin cancers.
I think the genetics is a good point because obviously we know our most common forms of skin cancer are induced by the sun, but we do have some skin cancers that are purely genetic, especially melanomas. I'll have some patients that come in and say, well, I haven't been out in the sun since I was a kid. I've protected my skin since I've been an adult. But really that sun exposure from when you were born, until you're a young adult, those changes, the damages to the skin from the sunburns can manifest as skin cancers later on in life.
Yeah. They think they're invincible though. At that age. It's a problem.
Exactly. Very true.